Researchers find that concentrations of a protein X in the serum can be used in screening of breast cancer. The levels of X are shown in the graph above, the two curves representing healthy patients and breast cancer patients. Which of the cutoff points shown above is most likely to be chosen for screening purposes? I'll wait 5 seconds and answer the question. So you'll get biostats questions like this on USMLE where they give you a graph or a picture of some kind, and it's all about you being able to apply your knowledge of the actual biostats concepts. This shouldn't be too hard because this is a screening test. What we're looking to do is to maximize sensitivity, even at the cost of specificity. And the reason for that is, for one thing, it's a screening test, so the consequences of getting a false positive are kind of low. Mainly, you're risking scaring the patient. That's really the main thing, and I guess it costs a bit of money. But in contrast, the consequences of a false negative in a screening test are very dire, right? Because if you miss somebody having a severe illness like breast cancer or HIV or whatever it might be, you're basically letting a patient walk away with an illness that you didn't detect, and it could kill them. So obviously we don't want that. So first, it's kind of obvious with that in mind that choice B is the correct answer here, right? That's a cutoff where we have achieved detecting pretty much all the diseases in the red curve, but we are not going overboard like choice A, where, we're kind of decreasing the specificity of our test unnecessarily, because it's not like we're getting any extra true positives out of that cutoff point. And then all the other ones to the right are just wrong because you're missing the diagnosis on multiple patients for no real reason. Now, for a confirmatory test, we might choose E or possibly even D. USMLE usually won't test you on confirmatory tests in that way because it's a little bit harder to have a one-size-fits-all kind of answer to that, because it's always a give and take with specificity and sensitivity. But in the case of screening tests, we're pretty consistent on saying, look, we want to maximize sensitivity. And for those of you who have not studied biostats at all and you still can't get sensitivity and specificity straight, sensitivity, most simply put, is the percentage of people who actually have the disease that you successfully test as positive, which is to say true positives divided by true positives plus false negatives, right? Because both true positives and false negatives actually have the disease, but sensitivity is about the percentage of them we caught, which is the true positives. And specificity is kind of the opposite direction, right? We're talking about who doesn't have the disease, who you successfully test as negative. So that would be true negatives divided by true negatives plus false positives, right? Because the people with true negatives and the people who have false positives both don't have the disease, but you only successfully or correctly tested them in the true negatives. And of course, for these curves, you need to understand that if I have a cutoff like the ones shown here, and I move that cutoff line to the right, I'm going to improve my specificity, but decrease my sensitivity. Why? Because if you move from, say, the line at B to the line at C, I have decreased the area under the curve for the red curve, right? Which means I have lower sensitivity. I'm detecting less of the people who have breast cancer. But I'm also decreasing the area under the curve of the blue curve, which is the healthy individuals. So I'm detecting less of the people with breast cancer, but I'm also detecting less of the people who are healthy. So I've improved my specificity at the cost of some sensitivity. It's not a hard concept. Some people just have trouble converting it over to, an image form after they learn the concept. So here you go. I hope you found this video helpful. I'll see you in the next one.